Well, as the Bahamas braces to reopen its borders to let tourists in once again, health officials say it's not without some risk. With the Bahamas appearing to have gotten a handle on COVID-19, the country's deputy chief medical officer maintains it will be incumbent on officials to have the necessary mechanisms in place to limit the reintroduction of the virus into the wider community. Here's Cleopatra Murphy.
As businesses gradually reopen and the Bahamas moves toward a July 1st reopening of its borders to commercial flights amidst the COVID-19 pandemic, Deputy Chief Medical Officer Dr. Delon Brennan says the country must have protocols in place to mitigate and minimize the chance of importing a large number of new cases of the deadly virus.
July 1st gives us an opportunity to a month to set up systems so that we can continue to monitor and put in protocols for when others are arriving. So, we've had repatriation exercises where persons have come in. We put in protocols whereby they had to have negative tests. We were able to monitor and we were able to sustain, no cases within that grouping. And so as we know we have to continue to open up in order to provide economic activity, and tourism being our main product, we are going to have to aim for that. So, the issue is we understand there is going to be some risk.
To contain the virus, Prime Minister the Most Honorable Dr. Hubert Minnis instituted emergency orders that took effect on March 20th, ordering the closure of all but essential businesses and put in place a 9 p.m. national curfew. Days later, he implemented a 24-hour lockdown and border closure that was extended, while the 24-hour curfew will be lifted on Tuesday. Brennan says COVID-19 numbers have stabilized.
We are showing 102 cases, and we've been at that number for a number of days. So we are not seeing a continuance of community spread with some sporadic cases popping up in the community. The few cases that we are seeing, those are still limited to clusters, meaning they're related to a case that we have seen before and a contact that eventually developed symptoms, or that we tested and they were asymptomatic, but they came back as positive. So all of that is a good thing for us.
Speaking in Parliament last week, the Prime Minister suggested that widespread testing is not as necessary in the Bahamas, noting that protocols that include contact tracing are adequate, and Dr. Brennan agrees.
The position for us is we should still test around the clusters that we have, so contacts of cases and or persons that are symptomatic. That is the strategy that we've used, and I think widespread testing is not necessarily going to be useful in that it's not going to yield anything that we don't already know.
With the country flattening the curve on the virus, Brennan says it does not mean people should abandon preventative public health measures, but stay vigilant.
As long as people are continuing with masks, they're continuing with hand washing, their social distancing. If they are sick or they are having any symptoms that might be suggestive, that they stay home or they give a call to their healthcare provider. Those are really the cornerstones of a good public health approach to making sure that we don't have a large increase in the number of cases of COVID.
Cleopatra Murphy, ZNS Network News.